Okay, this is the video for electrical stimulation for pain control. And really when it comes to indications for this, it's really just for pain control. Some contraindications and precautions include avoiding placing anywhere near or over a pacemaker. If the individual is pregnant, avoiding placing the electrodes on the abdomen, pelvis, back, or hips. You'd want to avoid placing this over the carotid sinus or over any skin with lack of normal sensation or over any damaged skin. Also, you'd want to avoid doing this with anybody who has impaired cognition, thrombosis, hemorrhage, or any malignant tumors. And of course, placing it over the eyes or internally at all. So my patient here today is Connor, and he's in the clinic for osteoarthritis of the knee. It's been bugging him, and so I'm just going to briefly describe to him what we're going to be doing and ask for consent. So, all right, Connor. So what we're going to do today in order to help you with some of your pain, we're going to do something called TENS, and what that is going to do is place an electrical current through the affected area, and it's actually going to inhibit some nerves that are transmitting that pain signal up to your brain. Okay, so it should help reduce that pain signal a little bit. Is that okay if we go ahead and proceed?
Yeah. Let's do it.
Okay, excellent. So I'm going to go ahead and have Connor hold this as I put the parameters into the machine here. So I'm going to go ahead and turn this guy on. And first things first, this uses 2 electrodes, and I'm going to place it on either side of the knee here. All right, and we're going to start by selecting a biphasic pulse current, and we're going to set this to continuous because we don't need to have any on versus off time. Don't need to mess with the ramp time at all. As far as time is concerned, typically we would set this for about 30 minutes, anywhere 30 minutes to 60 minutes, but for the purposes of this video, we'll leave it at 10. As far as the rate, for this type of current that we're using, this would be set anywhere between 80 and 110. So I'm going to go ahead and increase this. Oops. Set the time back. I'm going to set the rate right in between there at 90. And then finally, width, we'll want this between 50 and 100. And so I'm going to go ahead and set it at 75. Okay, so now that our parameters are in, I'm going to slowly start to increase the intensity until Connor feels a strong but comfortable tingle. Okay, so you're just going to let me know when you start to feel that, all right?
Okay. Yeah, that almost went up to like 55 before.
Yeah.
I feel a tingle.
Should I keep going?
I want it to be strong. Yeah, I'd say that's pretty strong.
Okay,
Maybe
cool.
down a couple.
All right.
There you go. Right there. Perfect.
How does that feel?
That's good.
Good. Okay, we're going to go ahead and start this cycle. For the purposes of this video, we're just going to leave it going for about 30 seconds. Okay, how are you feeling, Connor?
I feel fine.
Yeah?
I feel the tingle. Pain in my knees starting to kind of subside.
Okay, just let me know if anything changes. We can always adjust.
Maybe explain that what I didn't do, but maybe explain that I would have you doing maybe some exercise as well. It's, you know, I didn't explain that, but I was thinking, I could have said something like that.
Mm-hmm. All right, so that's 30 seconds right there. I'm going to go ahead and stop the treatment. I'm going to remove these electrodes. We'll check the skin underneath to make sure that there's no redness or any change in the skin tissue.
I pushed something. I don't know if it's still going. I think it is. It's just not on the screen.
Oh, okay. And again, the mechanism of action for this type of therapy is called gate control, where we're stimulating the A-beta sensory nerves in order to inhibit the sending of pain signals to the central nervous system. And that is TENS for pain control.